Hi, everybody. Thank you so much for joining us. Hopefully you are in the place where you're expected to be. So today we're going to be sharing the findings of the Learning Disabilities Joint Strategic Needs Assessment, which has been a joint product that we produced at Nottingham City Council together with our very well represented and lovely colleagues from Nottinghamshire County Council and the ICS as well. So you've got me sort of hosting, if you will, today. We've got Katie Fagan, who is the lead on this piece of work, who will be going over the sort of findings. And then we're really, really lucky to have Yvonne, Charlotte, James and Helen, is that everybody here to help us field your questions later. If you do have questions, the Q&A function is live, so you can ask those without your name being shared with the sort of wider audience. If you don't want to, if you don't want other people to know who's asked the question, you can do that via the Q&A function on Teams. The chat will be open, so we do encourage you to drop questions in there. Yvonne has really kindly agreed to be our question master today, so she should be sort of fielding those questions, but we won't answer them as we go through. We have some allocated time for that for you, so we'll go through them at the end, but do feel like you can drop them in as much as you like. And if you want to have yourself unmuted and speak using your voice and your or your image, then do let me know and I can do that for you if you're not able to do that for yourselves. So I guess I should let you briefly know who I am, actually. So my name's Maddie Leather, and I am a public health manager within the Knowledge and Intelligence team at Nottingham City Council within the Public Health Department. So one of my key roles is to oversee all of our joint strategic needs assessments. If you don't know what they are, don't worry, because I'll talk you through it in a minute. So please don't be scared off if you're not familiar with all the terms yet, because I promise we'll make this as accessible as possible for everybody. And I've sort of supported this work a little bit. I don't think I've done loads on it, to be honest, in the background, just helping it to keep moving along. But really, I can't take any credit for the amazing work you're about to see today. And I hope, though, that you will all find it interesting and useful. So if I can move to my next slide, because it's got a white background, it's really hard to see the white buttons. A little bit of housekeeping. The sessions are being recorded, and we've got a transcription and we've got the video being recorded, and obviously the audio as well. So if you don't want to be on the video, then please don't ask to have your mic or camera turned on, sorry. I will edit the recording before I upload it, so you will have a week to let me know. If there's anything in there that you're really uncomfortable with, then we can edit that out at a later date. But I'll be sending out the edited recording. I'll be aiming to actually share that on Monday. So if you want it out immediately, then please let me know before Monday. Your cameras and mics are set to be off. Like I've said, the live Q&A function is on, and there's an upvoting function on there. So if there's a question that you would like to see answered. If you have any questions, please do jot down my email address. I'm pretty sure I've remembered to put it on the last slide today, but don't hold me super to account about that because I can't remember, but I think I did. I will remind you later. So please do feel like if you've got any questions to do with JSNAs overall, you can ask me, but if they are topic specific, then you'll be speaking to my colleagues. So quickly, I'll be spending 10 minutes or less describing what a JSNA is and what it aims to sort of achieve. Then Katie will be taking over to talk about the findings of the work for sort of 20 minutes. And then we'll have 10 minutes or so for your questions and comments, and then 5 minutes just to close up, and I'll let you know what work's coming up in the future to give people, if you're interested, an opportunity to get involved in future work that we're doing. So what is a JSNA? JSNA does stand for Joint Strategic Needs Assessment, but it's a statutory duty, which means that we in public health are required by law to undertake this work. And we do it in conjunction with the Integrated Care Board, who sort of advise and oversee NHS services. So it helps us to better understand the current and future health and wellbeing needs of a population. So that might be like people seeking asylum, for example, or it might focus on certain behaviours. That might be substance use, smoking, gambling, or we might look at it in a certain context. So how is people's health impacted in the workplace, for example? But talking you through sort of why it is called a JSNA. So it's joint because the responsibility is shared with other organisations. It's strategic because we plan it and then we use that to inform future planning, decision making, and also the resources that we provide to different things that support health and well-being. The needs part is because we look at the current and future health, social care, and well-being needs of a local population. So it's sort of just looking at if people are not just if they're healthy, but if they're feeling good and they're feeling happy as well. And it's an assessment because it uses this collaborative approach, hence why we've got colleagues from different organisations here. It's evidence-based, so we don't just make it up. We do look at the science to draw our conclusions. And it's a real like analytical process where we run some really like in-depth analyses a lot of the time. So there's 3 different types, if you look on the right hand side of my screen, of JSNA products that we produce. These are clickable links, so when I share the slides around, if you want to have a little bit more of a look at those, you can do. But dashboards provide this really high level overview, and they're like an interactive thing where you can look at different data and it'll show you little graphs and have a summary. And they have a little bit of interpretation of that data, but they don't really tell you anything about what that means for future planning and strategy. So they're great for you because you can have a look at the data that you want to look at on a topic. So we've got one on health and well-being and one on children and young people at the moment, with others in the pipeline. So they're a really good starting point. And then we have our JSNA profiles, which is what Katie will be presenting about today for adults with learning disabilities. And that gives us a little bit more detail, including things like identifying different groups within that population that might be experiencing more disadvantage than other people, and where there are maybe some gaps in service provision locally. And we try to provide some recommendations about how to address any issues we've identified there. And then the most in-depth version we have is called a health needs assessment. And those provide a real deep dive are looking at a population's health. So different things we can produce, and today and often, most often, we'll be looking at profiles. So who can use the information that we have? We like to think that everyone can use it, and whether they want to is up to them. But people like policies and strategy makers will use it to inform their sort of planning and the guidance that they produce. Commissioners, which is where Katie was working when she did this work, will use like this information to fill those identified gaps in services. So commissioners are the people who actually they will like get a service in and organise for that paid service. So we might have like Changing Futures might be a service that you've heard of before that we commission, or maybe Thriving Nottingham if you've accessed them for stop smoking services and things. Service providers, so people like Thriving Nottingham, can have a look at this and consider and address any like issues or problems that they think are going to be really relevant for their work. Health professionals will be able to use it to have a look at who might be experiencing even more inequality and things like that. Community and voluntary sector organisations will have loads of opportunities to use this, and they're really good for informing grant applications and evidencing that there's a real need for services, or that there's gaps in services locally. And if you're an individual from the identified population, then this type of work should help you to self-advocate and also signpost you to good local services and support, and make sure that your voice is really being heard by professionals across the system. And of course, we can never forget the families, friends, and the loved ones and the carers and things like that of the people that we're looking at their health needs. And for them, it really helps people to have a better understanding, helps them to better advocate for people that they love. And again, it's signpost to local services and support, maybe not just for the people they're supporting, but maybe for themselves as well. So lots of opportunities for people to get involved if you would be keen to be a part of like producing some JSNA work. So if you're from another department within local authority, then you can sit on steering groups. There's the opportunity for you to help with recruitment, authoring the work, mapping and dissemination. There's actually the opportunity for other departments to lead on work. So we've had housing lead on the homelessness JSNA, commissioning has led on this adults with learning disabilities, one. If you're within ICB, lots of opportunities on things like steering groups recruitment, same for providers. Particularly providers are really good for helping us with dissemination, so sharing the findings. Within the education sector, there's loads of opportunities if people would like to help us do things like get ethical approval to improve our publication opportunities and things like that. Community and voluntary sector almost always help us to recruit and get us participants and help us to share the findings of the relevant people. And again, people from the population and their families, loved ones and carers and things can participate. And there's also sometimes opportunities for you to be experts by lived experience and sit on steering groups and help sort of shape the future of services for people like yourselves. And that's, I think, a really empowering and important thing that we really do encourage people to do if you're able and willing to do so. So you're probably all sick of the sound of my voice now, and that would be well timed if you are, because I'm going to hand it over to Katie, who can give me a Chris Whitty style next slide, please, whenever she likes, and I shall do that for you. So over to you, Katie.
Thank you. Hi everyone, I'm Katie Fagan, and I'm going to talk through the learning disabilities, our sort of findings and outcomes going forward. So this section moves us into the specific topic focus learning disabilities. We'll explain why it was selected as a priority JSNA area, how we approach the work, and what the evidence tells us about need, inequality and future demands. So why learning disabilities as a JSNA topic? Learning disabilities were chosen as a JSNA topic for several reasons. Firstly, this work refreshes our previous assessment and reflects new evidence and changing demographics, and obviously changes post-COVID. Secondly, people with learning disabilities continue to experience significant inequalities across health, employment, housing and life expectancy. Nationally and locally, learning disabilities are a policy priority with a strong focus on community-based support and reducing avoidable harm. And at a local level, we are now able to better understand the gaps and opportunities around employment, housing choice, transport and mental health support. Next slide, please. What is a learning disability? So before going further, it's really important to pause and remind ourselves what we mean by learning disability. A learning disability is a lifelong condition that affects a person's ability to learn new information, understand complex ideas, and cope independently. It's not the same as a learning difficulty like dyslexia, for example. People with learning disabilities are a very diverse group. Some people live independently with minimal support, while others have profound and multiple learning disabilities and require lifelong care. The link on the slide is a useful resource from MenCap, a short video which helps to ground our shared understanding and challenge assumptions. There we go.
There we go.
Thank you. So keeping this definition in mind is essential because how we define a learning disability directly affects identification, access to services and how inequalities are addressed. Next slide, please. Methodology. This JSNA was developed using a mixed methods approach. We brought together quantitative data, qualitative insights, and lived experience. We analysed a wide range of data sources, including GP learning disability registers, annual health check data, LEADER reviews, which stands for Learning from Lives and Deaths, People with a Learning Disability and Autistic People in the NHS. This reviews premature deaths to improve care. We also use data around mortality, social care packages, housing, employment and education trends. Where possible, we also use trends to model future demand. Alongside this, we completed a comprehensive review of national and local policy, guidance and research, ensuring alignment with frameworks such as the NHS long-term plan and building the right support. A key strength of this work was engagement and co-production. People with lived experience, carers, families, providers, researchers and advocacy groups all contributed through surveys, meetings and workshops. And if you're in the audience, I'd like to say thank you very much for your support and work on this. Finally, governance was in place throughout, with oversight from learning disability partnership structures and lived experience panels, ensuring voices shaped priorities rather than being added at the end. Next slide, please. What we want to improve going forward. So this slide brings together what the evidence and people told us matters most. There's a strong need for better mental health support that works for people with learning disabilities, not alongside them. People want stronger community support and activities that reduce isolation and increase belonging, independent housing and choice. Employment and training opportunities remain limited, despite clear evidence of benefit. Access to health services and health checks and screening needs to be easier and more consistent. And underpinning all of this is the need for truly accessible information that's easy to understand, timely and available in all the right formats. Next slide, please. So national statistics. Nationally, the data points a stark picture. Around 2% of adults are estimated to have a learning disability, yet only around 0.6% are actually recorded on a GP register. This highlights significant under-identification. Life expectancy for people with learning disabilities is around 20 years shorter, and a large proportion of deaths are considered potentially unavoidable. Screening and prevention uptake is also much lower. For example, cervical screening uptake among women with learning disabilities is less than half that of the general population. These statistics provide the essential context for understanding why local action is necessary. Slide, please. So our key findings, locally, the JSNA identified just under 7,800 adults with learning disabilities across Nottingham and Nottinghamshire. The majority are men, with most people aged between 15 and 44. Though we expect the number of older adults with learning disabilities to increase significantly over the coming decades. While local performance on annual health checks is strong compared to national averages, inequalities remain, particularly in employment and housing. Health risks are also significant. Many people have co-occurring mental health conditions, and dementia risk is much higher, especially for people with Down syndrome. Barriers such as long waits, inaccessible information, limited respite, and a lack of inclusive employment continue to affect the quality of life. Overall, the findings point to the need for better coordination across services and systems. Next slide, please. So slide 15, recommendations and collaborative opportunities. The JSNA doesn't just describe issues, it sets out clear recommendations. Key priorities include early diagnosis, better reasonable adjustments in primary and community care, and expanding inclusive housing and employment opportunities. There's also a strong case for developing a joint Nottingham and Nottinghamshire learning disability strategy to drive action. Mental health pathways need to be tailored specifically for people with learning disabilities and employment support strengthened. Co-production and workforce development are essential, ensuring lived experience shapes decisions and staff have the skills and confidence to provide inclusive care. Finally, collaboration across commissioners, providers, PCNs, primary care networks and local authorities will be critical. Next slide, please. So this slide provides a link to the full JSNA and supporting materials, which we encourage you to explore. There's also our contact details there if you'd like to get involved or discuss how the findings can inform your work. So thank you for listening. We're now very happy to take questions or comments.
Thank you, Katie. So I've got a few, if that's okay, just to get the ball rolling, and then colleagues can either put some more in the chat or could raise their hand. So the first one is around how could people get more involved if this was something they were particularly interested in? How could they get more involved in this? So I'll pass over James and Katie to yourselves, and also Charlotte, if you'd like to come in.
Yes, so obviously one of the pieces of work that will be coming from this is the learning disability strategy. So you've got mine and Yvonne's email addresses, and we can share our generic commissioning invoices, inbox email addresses at the end.
Thank you, Katie. Just before I bring James in, because you touched on something there, Katie, which links in with another question as well. So James, in your response, could I just ask you as well to include the sort of what next question? So the JSNA is a fantastic piece of work, really enlightening and helpful, but what's coming next?
Thanks, Katie. Thanks, Yvonne. And welcome, everyone. I'm James Wheat. I'm a commissioning manager at Nottinghamshire County Council. So I think what's really important about this work is it's probably considered as the start of a journey or a progression to the journey. It's not the end. We've done a document, we move on. So the JSNA identifies, as Katie's illustrated, some areas where we know there are strengths in our local system and some areas where we think there are opportunities to improve collectively. And just as a note, as Katie referenced, we've previously done JSNA separately, so Nottingham City Council had their own, the County Council, and we've worked together in a more collaborative footing this time, recognising that sometimes our borders and organisational structures don't necessarily mean as much to our public as it does maybe to us. So I think it's a much stronger document. So if people on the call haven't had a chance to have a look, please do try and have a look through that document. There's so much information in there which we're really wanting and proud to share with everybody. But as you say, Yvonne, that's the end of the work. So as a system, we are committed to creating our first learning disability strategy. And what we have all been absolutely clear as partners, we don't want a document which looks fantastic, it has all the infographics you'd expect and doesn't do anything. So the strategy is really a springboard into an action plan. So we've got the JSNAs, the needs assessment, we've got the strategy which will set the vision, and then we're going to have an action plan where we want it to be transparent, we want it to hold all of us to account. What are we saying we're going to do? And obviously there are no magic wands, but there are things we're probably able to achieve and things we may not. But we really want to be really clear as to how we're going to use the resource available in Nottingham and Nottinghamshire, health and social care, to try and make a difference locally, and where are the things we're going to target. So to answer the question around colleagues on the call, irrespective of your role or the requirement as to why you're here today, we want to hear from people as part of that strategy development. Have we got the vision right? Have we got the areas of focus right? How do we know if we have or we haven't? So we will put some emails, as Katie said, are County Council and City Council commissioning inbox emails. If you've got any interest, I can see Katie, I think it's just on the one for City, in being part of the work or even hearing more about how it's developing, please do just pop us a message and we will kind of add you to that list and we'll be in touch. But we'd be really keen, irrespective of kind of the reason why you'd want to get involved, with as many wide views as possible. So if you're able to kind of be part of that work or hold an interest, we'd love to hear from you. So thank you. Unless Helen or Charlotte has anything further, I'll hand back to you. Thanks, Yvonne.
Thank you, James. I'd just like to add, to that really, just to say that as you'll have heard from Katie and read in the JSNA, there's quite a lot of areas actually that we feel that we need to focus on. And as James said, we'd really like to hear from you to find out whether we've got that right. But as well as that, I think what we'd like some help with in terms of what we want to prioritise. So generally, when we set a strategy, we'll think about, we might set a strategy over a number of years. So it might be 3 years, for example. So we might want your help really in defining. So what are the things that we need to focus on in year 1? What might we then want to focus on in year 2 and year 3, etc. So as well as helping us with that initial, have we got it right? Is there anything missing? It would also be good for you to help us set our priorities in terms of how we kind of stagger that and schedule that over the course of the strategy. So that was anything I wanted to add. Thank you.
Thank you very much. Just a bit of a follow-on question, if we can. It might be, you know, obviously people's diaries are incredibly busy, but it might be one aspect of the JSNA, perhaps the tackling inequalities, for example, that someone is specifically interested in. Would that be possible if there was just one particular area? It might be a provider or a colleague working in the council or in the caring industry, that they could just express an interest in that particular section and help work with us in terms of that and the wider partnership. So I'll just open that up to ICB partners and James, if I may.
I mean, I don't mind coming in. Absolutely, Yvonne. I would say that I would imagine there will be organisations on this webinar right now that might have a particular focus, a particular area in which they support people, whether that be, like you say, it could be something like housing, there could be housing providers or employment organisations. So absolutely, if there's one particular area that people want to support with, then that would be very much welcomed.
Thank you. Helen. So hand come up. I'll pass over to you, James.
Oh, sorry, Yvonne. Yeah, I think we've got Bryony's hand up actually. I'm not sure if Helen's also up.
Bryony, would you like me to unmute you?
Yes, please, Maddie.
Have a look. Allow mic, and I'll just allow camera. You should be able to turn them on for yourselves now, Bryony.
Thank you.
Hello.
Thanks. Hi. Thank you very much. I don't know whether or not you're going to be able to help with this question. I'm hoping very much you are. It's really, really interesting. So just to introduce myself, I'm Bryony Warren. I'm actually responsible assessor for the lung cancer screening programme in Nottingham and Nottinghamshire. So the fact that you brought up screening was really interesting to me. Now, we've worked really hard with the learning disability nurses team to try and have adaptive appointments for people that have been identified as having a learning disability. And interestingly enough, so it's a slightly higher age range. Lung cancer screening is for age 55 to 74. So obviously a higher age range than what was shown on your previous slide. What we've aimed to do is identify these individuals and invite them to a face-to-face appointment as opposed to doing telephone triage, which is our normal rate. We also try and ring them before to make sure that the time is suitable for them, to make sure they're not in any daycare and it fits in and they've got support to bring them. Despite us doing that, we still have a 30% DNA rate to these appointments. Now, when I took this back to the learning disabilities team, they said it's not unusual for this. They have that quite a lot with the normal health assessment needs. And it made me feel quite sad that actually that was normal. And I just wondered whether anybody had any support or guidance, because we really want to improve our uptake, and wondered why this might be normal and if there's anything we can do to help. That was the first point. But the second point is we get a lot of individuals opting out straight away of screening. We've tried, so last year we were involved in the screening. The learning disabilities team did a screening day at Nottinghamshire Council building. And we try to promote as much as possible, but again, any support or advice that we could have to try and improve and engage, that would be greatly received. I don't know if anybody's got any ideas. Thank you.
Yvonne, I'm happy to come in initially, and then perhaps other people might want to come in. I can see that Helen has got her hand up, so I'm hoping that Helen will want to come in. Bryony, really, really good question. And we do know, as you've said, that screening is a particular issue. One thing that can help is, and you've talked about some really good adjustments that you've already thought about making, but what can help is if people are really shown what's going to happen at the screening appointment. So I do know that previously there has been kind of films made about particular we've done screening in the past, but other things, other hospital appointments, etc., just so that people know, well, what's going to actually happen when I get there. Has there been anything like that produced, Brian?
Again,
okay.
It took us nearly 3 years to identify an individual that was really happy to be filmed, but we did get an individual that was happy to be filmed, and we actually showed the start and finish process, and it's on our website. So there is a live video so people can see what they're expecting, what might happen. So yeah, we've absolutely utilised that. But thank you, that's appreciated. But again, I don't know how far it's actually reached out to people, so I guess it's whether or not people are accessing the website.
Yeah, no, I think we could perhaps do more promotion so that people know that that's there. I think that would be really helpful. I can see, sorry, I don't want to take over, Yvonne, but I can see Helen's got her hand up, and I don't know, Helen, if you wanted to come in and answering that particular question.
No, that's fine. I'll bring Helen in and then James, and then we've got 2 more hands up, which might be separate questions, but might be linked. So Helen, please do come in.
I feel like I'm jumping in, apologies. So I'm Helen, I represent Nottinghamshire Healthcare Trust today. Bryony, great point. Yeah, I think it's complicated, isn't it? There's lots of different factors why people don't engage. I wonder if a really good step would be to make an invite to your team to come and join our teams at some of our locality meetings, because I think establishing those relationships between professionals is something that can really help us help the individuals, isn't it? So if I drop the details in the chat for our clinical team lead, and I'll let her know that you might be in touch to organise to come and talk to our localities, because then we can get on the ground with the kind of people that we want to get to the screening appointments, can't we? So that might be, it's not going to fix the problem, but it might be a step towards making a bit of a difference.
Yeah, thank you.
Thanks, Helen. And then James.
Thank you, and apologies those with the hands up if I've likewise jumped in. But to answer the question, I suppose, thank you for raising it, Brian. One of the important kind of elements of a JSNA is so the recommendation 6 actually speaks specifically to this, to increase kind of uptake of screening in those appointments. And as a result of this, within the kind of accompanying action plan, there's going to have to be a plan of how we're going to support this, what as a system. And it's not necessarily just us as system partners talking to each other, but how can our providers and our voluntary and community sector support and work within that earlier question around if somebody's got a particular interest in supporting one particular area. That's where I see that playing out. Like, we definitely won't have all of the end-to-end answers, and nor does the JSNA kind of expect that to be the case, but it illustrates there is an inequality, and obviously in an evidence-based way, which you've just reinforced, Brian. Not only is our uptake lower, actually even the appointments potential is that there's a disproportionate connect between the general population and adults with a learning disability, and we'd like to better understand that and also work out how do we improve that position. So I think for those on the call, this is really where I think this work becomes quite exciting, because it's all about trying to make things better, improve, and that's an area where I think there's an opportunity to do that. So that's what those kind of action plans will do. And really importantly, I know I mentioned it earlier, what we really want as partners, so everyone on this call who's presenting, we want this to be transparent. We want to be really clear, what are we saying we're going to do, and in the future, so whether or not that's in increments of 3 months or whether it's in a year, that's obviously to be agreed. There is a published position. What have we done about this? Are things improving? How do we know? And I think that changes from the historical JSNAs where maybe we've produced them, we all get onto other work, which is all really busy and important. So it's just to say, if people are committing, and Brian, it sounds like you could be really well placed to help us think through some of that. We want you to know it will matter, and obviously we want to ensure that we can improve where we can. So thank you. I'll pass back over to you, Yvonne, and thanks for those with a hand up with your patience.
Thank you, James. Michelle, so Maddie, would you mind just unmuting Michelle for us?
I've given permission to people with their hands up.
Thank you. Michelle, I didn't know if it was a separate question or aligned to the point that Bryony made.
It was kind of aligned to the point that Bryony made. I mean, in my current role at the minute, I work around transition into adult services for young people, but I am a learning disability nurse. I'm learning disability nurse trained, and it's a long time ago now, and I'm sure that I won't be able to impart any other knowledge that, you know, some of the primary or acute care liaison nurses have done. But I was just going to invite Brian if she wanted to contact me some of the things that we've done in the past, because it was not just about looking at those that either do physical or cognitively unable to follow tests or do tests, what you do to support those people or educate carers to look out for warning signs or red flags or whatever. So I just wanted to say that if you wanted to get in touch, you're quite welcome. Not that I may be able to, you know, impart anything extra, but just from historical work that I've done.
Thank you. That's really helpful. Thank you.
Thanks, Michelle. That's a really kind offer. Thank you. And I'll just move over to, I'm so sorry, I'm going to pronounce this incorrectly as best as I'm going to try. Is it Beata?
It is Beata,
Oh,
indeed.
Over to
Or
you,
as
Beata.
close as it is. I am a social worker in a whole life disability team in Nottingham City, and it is all very exciting. Albeit nothing new, in the sense that we know that issues are, and Helen and her team is absolutely fabulous in supporting our peeps if we need them to attend stuff and have a blood taken. So a big screening like lung screening or cervical screening is for some of our people completely impossible to attend because they won't be able to understand it. However, the question the support I would like, I don't know if I've got any better ideas than anybody else on highlighting how we can support, but I am open to working in a bit more in partnership with the teams who would be organizing those screenings, because we work with a lot of people. Obviously we have them in our caseloads, but then we can contact you with support providers of those people who could have group sessions, who could have information sessions, or that video which we don't know if a single person would have watched, but if we have a session where group would watch it and have questions, obviously it all depends if their abilities and all that, but that can be all worked out slowly but surely, maybe. But it might just help with that, because where I'm sitting, my biggest issue is housing and support, and I would like to know what I have it written down. There you have it. It's all about the action plan and who will be implementing that action plan. I want to know who will I ask the questions of, because I am volunteering my help, but I have no first idea of how many houses are actually built, or are there any built for people with learning disabilities, because I don't think that is the case at the moment. So I will email the link which was there to volunteer any future work and my participation in it. But yes, I would like to know, sort of separate question, is who will be implementing an action plan and how do I know who is it?
Okay, thank you. James, I'm going to bring you in at that point because this links in with the strategy and the work streams that sit under that, doesn't it?
Yeah, thank you, Beata. I think that's exactly the point. So who's going to do the work to kind of progress this? And I think clearly these are kind of multifaceted, wide issues. It's not just a singular, and that's why I think going back to the JSNA, we were very clear we want to construct this as partners, as organisations, as a system, because that's where the most change can happen. But the risk with that is if you have lots of different organisations without real clarity of who's doing what, does anything actually change? And I think the point you made, some of these issues and inequalities identified on the JSNA are known, and I would agree that some of the challenges faced and some of the opportunities are similar to perhaps what we've identified previously. So we want a public-facing action plan, and I think we just need to obviously be proportionate. And I'm not kind of using it flippantly. There isn't a magic wand to change some of the challenges. We know, for example, housing is a space where there are broad demands and opportunities, I must add as well, and there's lots of work going on at the councils to try and support that. But we want a public-facing action plan which is really clear who is the action owner and who are the kind of supportive partners. So it's very clear to anybody, whether that's a member of the public, an adult with a learning disability, us as professional and partners, who is actually leading this, when are we expecting to see meaningful change, and what are we going to do if things haven't being progressed. So that's the point of that kind of document, and we want to stress, and it's not just, I know you're hearing from me saying it, but everyone on the call who's been part of this work, we've subscribed to this as a position. We want it to matter and make difference. We just need to be really clear that it doesn't necessarily mean we can change everything overnight, and of course I don't think anyone would expect that, but I hope that helps a bit. So it's going to be published, it'll be on the local authority websites, and presumably, Charlotte, I hope this is correct, the ICB will certainly hold links to this, so it's a very easy, accessible area. Who's doing what? Is it working? How do we know if it's not working? And the action owners are really important. So if it's not working, it's not around potentially pointing fingers, but it is holding us all to account. How are we making a difference in this really important area, which obviously I recognise we're all on the call because we recognise the importance of this space. Do you want to add anything to that, Beata, before I pass back to Yvonne? Thank you.
Yes, I mean, not much, but it's not about pointing fingers. It's about me asking, who am I asking what is happening? Because website is all well and good, but if you don't know that it exists, you don't know it exists. It's for everybody, it's the same thing. People with learning disabilities won't know it exists. Therefore, how do I don't know if it exists or not. So how do they know it exists? So, and as I always say, in my previous job, I was an interpreter and I speak languages, right? And if I didn't say it, it means it didn't happen, right? It haven't been said. Therefore, if I don't know about it, nobody else does, because I can't spread the word, so to speak. So yes, my animation is, I am very passionate about housing and employment of my peeps, and I would like to make a change. I just don't know how. So there we have it. That's it. Stop moaning now.
Thank you very much. Thank you. Stacey, if I can bring you in next, and then the final question will be with Rafaro.
Yeah, I'm going to try and keep it succinct because I find this quite emotive because my auntie had a learning disability, so I've got sort of that personal experience. So I won't read my whole list off, but it would be interesting to talk to someone a bit more in depth, I think, after. In terms of my job, I work in economic development in the City Council, so I guess from a work perspective, I'm interested in how I can support with the sort of employment aspect. And I think it's important to point out that I think the county has a very different provision to the city. So in the city, we don't have a specific local authority-led employment support service for people with learning disabilities. And so I think it's really important. I think we will talk about, we've got an inclusive recruitment hub happening where we're sort of trying to work with employers. But that's broadly about being inclusive generally, not specific to learning disability. And then there's a Connect to Work programme, which I think it can support people with learning disabilities, but they're not necessarily targeting that cohort. So I'd be interested in knowing, whether public health, or if there's any funding to sort of look at that in more depth, or to try and apply pressure to the local authority to have their own sort of support employment programme. So that's sort of one point. In terms of what's missing, I can't, there's not really a lot around carers. So I guess there's two things. I guess those who siblings who take over care of their brother or sister when their parents pass away, you're not sort of given a handbook. So and there isn't any support at all really. So from personal experience, my mum took over looking after her sister with Down syndrome, and then I think she started looking after when Teresa was like 40, and from that point Teresa developed epilepsy, went on to have Alzheimer's, and there was no sort of warning, and actually it's really prevalent with people with learning disability. And I think I'd worked within, because of my work, I know about the Alzheimer's stuff, so I'd sort of encourage her to be on the pathway. So it's that sort of thing. I think there's nothing around that support, I guess, in terms of there's a lot around education. So I know we spoke about the multidisciplinary team, which is what happened with Teresa, but they sort of provided a diagnosis, would have meetings, but there was no actual sort of support, because there is no support actually in place if you've got Alzheimer's in the community. So Alzheimer's Society don't do anything particularly with people with learning disabilities. There wasn't anything in place. So, and I don't know if that's like a funding, but it's sort of left there on your own, out on a limb, really. So I'm glad that that's sort of come up in this, but it'd be interesting to see that. In terms of health checks, I think it'd be interesting to know what's the follow-up from that. So it's great that there's a take-up, but if you speak to a learning disability nurse, they will say it does feel like a little bit of a tick sheet. So what's the positive outcomes from that? Because from our experience, we had it, but Teresa was underweight. She wasn't referred to a dietitian or anything. I had to sort of help advocate. So it's that, I think sometimes things look great on paper, but what's the actual effects for the people in the community? And I wondered if there was a deadline for the strategy and health, also in terms of the screenings. There's no adaptation in terms of how breast screening can be carried out. So you basically have, if you're not into having your boob clamped, which my auntie wouldn't have done, they wouldn't do like a handheld scan or anything like that. So that would be a really quick win. So it's that sort of stuff where I think sometimes people are willing to have a screening, but there's no adaptation. It's just if you can fit within that remit. I must say, actually, the learning disability support for epilepsy is really great. Actually, the QMC, we had a specialist nurse and she was brilliant. I'm trying to think what else. Yeah, sorry, I won't go on because I've got lots. And also I think also thinking about the impact of sort of budget reductions within local authorities. I know, for instance, within the city, I think this year we need to reduce our budget by £1 million. So that's not conducive to providing the right support for people. And I know that it's mentioned about low uptake of direct payments, but I think there's probably an argument that people aren't being offered direct payments. So I think it's just being really clear about why that is. I know, obviously, you've got to sort of delve into what's happening there. Sorry, I'll stop now. But it's just there's quite a few elements really, and I think the local authorities work in quite a siloed way. So I think, speaking from my perspective, we've probably missed opportunities on several occasions to sort of link that employment support, because there isn't the working relationship with sort of adult social care, children and families, and sort of economic development. So I think it's about people not seeing themselves as being responsible. So adult social care will find themselves responsible, but there isn't it should almost be the local authority really, rather than just within that group. So there's not like the pull for economic development to have to act on it. Sorry, that's stop now. That's my lot for today.
No, that was really useful, Stacey. I can see that Helen's got her hand up, so let me bring Helen in first, and then I can open it up to the rest of the panel. Thank you.
Hiya, Stacey, can I talk to you about a couple of dementia-related comments?
Yeah.
Because obviously that's a big area for me. I'm the lead psychologist for intellectual disabilities in Nottinghamshire, and we absolutely recognise that the post-diagnostic support is not what we would like it to be, and we're looking at how we develop that, but also recognising that NHS funding only goes so far. So we've gone to our colleagues in the ICB, and James, you can help me with this a little bit, I think, can't you? And kind of identified that is a bit of a priority to work more in conjunction with the voluntary sector and the third sector to look at what that post-diagnostic support could be. And also, we are in the process of redeveloping the training offers that we do for people who support people with intellectual disabilities who develop dementia. And we've had an offer for paid carers for a while. We have a training package, which we're currently in the middle of redeveloping and updating. But actually, I also want us to develop a family carer package. So I think that might need to look a little bit different to what we say to paid carers, because the dynamics are different, the emotive elements of it are stronger. And it would be really good, actually, if we could work with some people with lived experience to develop that. So I'm wondering, can I take you as a bit of an offer perhaps
Yeah,
to run
definitely,
some
yeah.
of that past and link up a little bit. We'll be going out to other groups to try and do that, but we want to get it right, but it's slightly new to us and needs a slightly different nuance than we do for our paid carers. So if I can grab your details off the screen, can I come back to you and ask if you'd be
Yeah, of
prepared to
course,
come and
Helen,
talk to
yeah.
us? Thank you.
Yeah, no, definitely.
Thank you, Helen, and thank you, Stacey. You raised some excellent points there that's going to be really useful, and that lived experience will add so much value, I know. I'm really keen, and just in the last sort of moment that we've got, just to bring Rufaro in, who sat very patiently for me in line there. So Rufaro, over to you.
Hi, I'm from JSNA Exclusive Care. Just a quick question, really. I just want to find out, does the JSNA include the current market position on inclusive housing, or is that going to be a separate project altogether?
James, would you like to come in on that one?
Yeah, thank you. I think that's a good question. So it doesn't talk about the signalling in the future. So a market position statement is a requirement for local authorities. So Nottingham City will have their own and the County Council has its own. And it's essentially a signalling document to the public and to potential partners and providers around what do we identify are going to be the things we're going to do in the future to work with our kind of market of organisations to meet the identified need. That's a bit different from the JSNA. So the JSNA, as Madeline kind of set out, it tries to look at where are the inequalities and the gaps and just makes recommendations specifically around how we should be focusing our time and energy. So they're slightly different, but they are of course connected. So I definitely understand the question. The County Council, I can't speak for Nottingham City, the County Council, we have written a new market position statement. It's just going through its final rounds of governance. So I would imagine imminently it'll be published on our website. And the easiest way to find it, and I can pop a link in the chat, is if you just put market position statement and then the council's name, so Nottinghamshire County Council, it will take you straight to the landing page, and wherever the most recent document is, you could click it. So just for reference, if anyone wanted to see those documents and understand what that was about, that'd be it. Thank you for the question.
Thank you, James, and thank you everyone for the excellent questions today, and very importantly for those offers of help. It's incredibly, it's so welcomed, because I know what a busy time it is for everybody, and it will really help to inform the strategy and the work streams. I'm going to pass back over to Maddie, and thank you again.
Thank you all. That was a really interesting discussion. I wish that I'd scheduled this for a bit longer now. So just quickly then, off the back, I guess, of some of these offers of help, just to let you know what work we have upcoming. So a piece of work on dementia and Alzheimer's, which is pretty much done now, due to be published, but there'll be a webinar on that and there'll be upcoming work on that in the aftermath. Same for healthy weight and homelessness, as well as adolescence and inclusion health, which looks at the Gypsy Roma traveller community, people who are on probation, victims of modern day slavery, and people undertaking sex work. Very proud of myself for remembering that off the top of my head. Also, you can see others on there, some around food security, which are due to commence, all age alcohol related harm, LGBTQ plus health, which will be the best one ever because I'll be leading on that. Children in care and care leavers, teenage parents, pregnancy and prevention for that group, vaccinations, and also some really interesting work around HIV and around communities as well, and cohesion and volunteering and things like that. So probably opportunities if people are interested to be involved in that. Please do email me. I did put my email later in the slide. If you're interested to be involved, let me know which one you might be interested in, how, and I can add you to spreadsheets for when that's coming up. We've got some links to policy that are relevant to this piece of work today that's left there for you, should anybody want to delve into that a little deeper. And apart from that, I know I've just spoken at 1,000 miles an hour through the last slide, so I hope everybody managed to keep up with me. Thank you all so much for watching, and most of all, really from me, thank you to sort of Katie and Yvonne and James and Charlotte and Helen for being here to sort of support with the dissemination of this work. Great job on the question mastering, Yvonne, very slick. And I hope that you've all enjoyed it. So I'll ask my team to stick around for a minute so we can debrief, and everybody else is welcome to leave us. Thank you all so much.